for whatever reason, I could do no wrong with Clint. And I know better, so do a lot of people. But he was somebody who just always gave me this wonderful support and grounding. We talked about all kinds of things. I found out that he had lived off of Oz Park in his early married days with Dale, his wife, and that he was partly responsible for the development of that park and the kids' playground. That used to be just this wild housing development in years past, eventually transformed into a park. This is in Lincoln Park at Webster. As I said, our offices were right across from each other, and Clint had an American flag hanging in his window. I could see it from my office. We were often on the phone talking from our offices. And when I got married and inherited a 10-year-old stepdaughter, Clint had already raised his 3 kids, although he was so involved as a dad, Taylor, Carson, and Nick. I've been hearing about them since they were in high school, went to college. They were looking for jobs. They were looking for spouses. I once asked him, I had this issue at home where Barbara said she didn't eat half of a container of Crisco that was in the fridge. There was a container of Crisco in our fridge, and at some point, half of it was gone. And she said, I didn't do it. And I knew I didn't do it. I knew Ken didn't do it. And my concluding line was, well, I guess one of our neighbors came in the house and ate half of this jar of Crisco. And I was telling this to Clint, like, what do you do when there's this suspended untruth out there? And his comment was, it's just Crisco, and even 11-year-olds have a right to their privacy. And that was just one of many wonderful gems of advice that I got from Clint. Even when it was difficult for Clint, health-wise and business-wise, he continued to hire Job 1 students, and sometimes 2. We have Jim Buick in the room, who has been a longtime supporter of that program. And it often just couldn't happen until I gave him a call and asked him myself, and then he would do it. So, a lot of you knew Clint, much longer than I, but just the unstoppable energy and enthusiasm. I guess that is a word that would sum up Clint, and just remembering everything you said to him, following up on things, just always interested. I loved that aspect of him, and it inspired me to try to be as observant and as good a listener. So thank you for allowing me to say these words about Clint Krislov. So Alita will come up and do the honors.
So in Rotary tradition, we set a place for our Rotarians that are no longer with us, and that is this place that is next to us. If I could get everyone to please rise for a moment of silence to recognize our member, Clint Krislov. Thank you. And she's right. I used to call Lisa every year and go, so can you call Clint and see if he's going to take some students? Because he won't answer our emails. So he was a great supporter. And next we have a wonderful presenter coming up, Richard Siegler. Please honor everyone's time in keeping your questions succinct and 1 question per person. If you are on the Zoom, please put your questions into the comment box or the chat, and we will make sure that those questions are answered. And with that, if Marshall can come up and introduce Mr. Siegler.
Thank you, Alita. When Tricia asked me to introduce Richard, I enthusiastically agreed. Richard epitomizes what it means to be a Rotarian. Ever since he graduated from college, he has committed his life to helping people in Africa, beginning with the Peace Corps in 2007 in Benin, through his current engagement as president and CEO of Bulamu, and I may not be pronouncing that correctly, but Bulamu Healthcare. Richard has put together and run organizations that have made an amazing impact on training, education, and the provision of healthcare in Africa in various regions, currently Uganda. Richard grew up on the south side of Hyde Park. His parents were associated with the university. His dad, I learned today, practiced medicine for 56 years and helped shape the world of medical ethics. So it's no small wonder that Richard has been raised to do what he does today. I had the pleasure of meeting him for the first time when he joined this club shortly before the pandemic hit, and then he moved his family up to Barrington, and so unfortunately we lost him as a member. But we've stayed in touch, and he's stayed in touch with this club, most recently seeking our support in an effort to be named one of the projects of impact for his work with Bulamu. So please welcome Richard Siegler, and appreciate that we've lost Clint, who was a great Rotarian, but Richard is a great Rotarian, and he's here with us. And let's appreciate all his contributions and that we get to share him today. Thank you.
Good afternoon, everyone, and thank you so much for having me today. A couple of introductory comments. What you're seeing here is not my work. What you're seeing here is the work of a team. And a couple of my closest team leaders are, I think, with us on the Zoom call, and one from Uganda. We may hear a word from them later today. The second thing is you're seeing work that you have helped to make possible. What I'm going to present is a global grant for about $250,000 that is underway, fully funded. We are doing a maternal and newborn health program thanks to the Rotary Foundation, thanks to your club's support. One of about 30 clubs that pledged and contributed. And then I'm going to share with you a vision, which is our team is one of 2 finalists for what is called Rotary Programs of Scale. First, what you see on the screen is a training that used to be called Helping Babies Breathe. And that is, it actually came out of Chicago, out of the American Association of Pediatrics. And this is the correct technique for resuscitating a newborn that is choking at birth and is not yet taking her first breaths. And when this is taught to maternity workers and they deliver babies using standards of care, this reduces newborn mortality by about 50% in low income and middle income countries. So I want to start just by having everyone picture that some extremely effective interventions for newborn mortality are as simple as practicing with a medical doll to be sure that the person knows how to to resuscitate that newborn that isn't yet breathing at birth, but is otherwise entirely viable. And now we'll come back to that in a little bit. So I'm sorry to say I have to share a global problem, which is maternal mortality and newborn mortality are not improving. And that has been the case. They have been, the mortality rates have been stagnant since about 2015. The world has made a lot of progress on other health issues, but if it's maternal and newborn mortality, we are treading water. And our team's work focuses on Uganda, but it's a bit more than 60 countries around the world that are behind on the UN Sustainable Development Goals for healthcare, which are intended to be achieved by 2030. And the issue is many countries have public health systems that lack training, lack equipment, and the result is their health system does not deliver standards of care. There's a reason newborn maternal mortality rates are very low in Europe and in the US, and significantly higher in countries that are behind on training and equipping their health facilities. Let me get more specific. 4.5 million newborns, stillbirths, and pregnant women die each year since 2015, and it's not going down. About 70% of those deaths take place in sub-Saharan Africa. In sub-Saharan Africa, that means there is a 1 in 41 chance of a woman dying from pregnancy in her lifetime, what's called a lifetime maternal mortality risk. And again, fortunately, these are things that can be prevented, can be treated, but those standards of care have to be delivered. In Uganda, to focus in, newborn mortality is about 20 deaths in the first month of life per 1,000 births. That's 2%. That's 1 in 50. And the main causes for newborns are asphyxia, choking at birth, not getting to start their breathing, being born prematurely, and infection. Stillbirths add to that rate and bring it to more like 3 or 4% of pregnancies ending in death through the first month of life. And the lifetime maternal mortality risk in Uganda, it's 1 in 47. So 1 in 47 women may die around a pregnancy in Uganda. Now there's an interesting opportunity, which is about 40% of births take place at home. So if things can be done where births move to professional health facilities, the newborn, the mother, the whole family structure can get considerably protected. So let me share with you a baby and a mother who our team served. About the middle of last year, a mother is told your life is in danger. She starts trying to give birth at home. That doesn't go well. She's rushed to a hospital. The hospital, the doctor who would provide the C-section is not there. And then our team gets involved, and we provided a little bit of money on the order of about $30 to pay for fuel in an ambulance and move the mother to another hospital where there is a team we had trained in essential newborn care, and they deliver the baby. And along the way, the health workers are checking, and they're not hearing a heartbeat. And someone says to the father, we don't think that the baby is alive anymore. We're going to try and save the mother's life, but we don't think the baby is there. And the team who we had trained a month or two before this took place in techniques including helping babies breathe, the team said, well, what we learned from our training is we keep working obviously to save the mother's life, but also in case there is a live baby there. And so they deliver the baby, and the baby is not breathing. And then they resuscitate the baby using the technique we started with. And now the mother is safe, and there's a live baby crying, and they hand the baby to the mother. And the mother, with all of this having happened, names the baby Miracle. So the good news is that this can be done, it is being done at significant scale, and it works in even very challenging contexts. And I want to recognize the doctor who was on that care team, because I've seen him a couple of times in the last year, and he said something to me that has always stayed with me. He said, we look at it, our team looks at it as a question of, are we going to send a mother home with a psychosocial trauma or worse for the family, depending on whose health might be impacted or lost? He said, or are we going to send a mother home with a live baby? And so that doctor in Uganda, working in a rural community hospital, gave everything with his team, but they needed the right training. They needed a little bit of support to do that work. So the good news is maternal mortality, newborn mortality are reduced in many contexts when simple training is provided, a little bit of equipment, making sure facilities have some basic things that they need to provide care. And this can reduce both newborn and maternal mortality by more than 40%, even more than 50%. And when you talk about 4.5 million deaths and realize that more than 50% of those are preventable, are treatable, it's a very significant opportunity for Rotary to be of service. So it's worth recognizing that this work actually started from conversations I had with other members of Rotary One. Marga Huco was the president in the year I joined, and she put me in touch with Pat Merriweather, the past district governor based in Naperville. And Pat's comments were, you know, the work your team was doing is great, but you just need to look at these other opportunities around newborn mortality, maternal mortality, and delivering completely proven standards of care. And for those who've had a chance to meet Pat, I thought it was not surprising when within a year or two, the World Health Organization adopted this newborn care training, which is why the name changed, and it's now known as WHO Essential Newborn Care. So what we are doing through a global grant, and what we hope to do, we're one of 2 finalists for this year's Rotary Programs of Scale, which is an impact prize I'll speak to in a minute, is we're trying to increase the number of women who get prenatal care at professional health facilities. Something that simple is extremely important for prevention, because it can identify women with high blood pressure, can identify women who are at greater risk of a range of complications in birth. And those are the things that are most likely to cause maternal mortalities. And of course, it encourages the woman to come in and give birth at the professional health facility. And now the mother gets standards of care, the baby gets standards of care. And then it sets them up to get vaccines, it sets them up to get follow-up care. So it is the simplest and the cheapest interventions here that actually can have the most impact, because it's so much easier to treat a woman, say, who is at risk of giving birth prematurely. It's so much easier to start that treatment in call it her second trimester, than it is to try to address that baby that is now prematurely being born. So we have a global grant we're implementing, and that work we've designed it to lead to a Rotary program of scale. And now I'll just describe what our program of scale application would do. We would like to support 1 million mothers and newborns over 4 years. And we'd like to reduce the newborn and maternal mortality rates in Uganda uh, through that process by increasing the numbers of women who give birth at professional health facilities and training the maternity workers who provide their care so that they are providing standards of care. And we would do this through about 200 public health facilities that deliver babies, and they deliver on the order of about 200,000 babies a year. So we might well end up supporting more than 1 million mothers and newborns, but we wanted to start with a number that we could very safely reach and could work up to. And we would long-term like to contribute to Rotary's public health campaigns, where the work Rotarians do in so many countries on maternal and child health, among other areas, has informed what we would do. But we think that there's an opportunity for this work to be done at more scale, and for Rotary to really be a global leader on an issue that is of similar importance to HIV and AIDS, similar importance to polio. Where polio is now, polio 40 years ago resembled the kind of maternal and newborn mortality rates we're looking at today that we need to make progress on over the next decade or two. In practice, we're going to train about 1,000 maternity workers, and we're going to equip 200 public health facilities that deliver babies, providing some additional support systems to make sure women have access to emergency transport and have access to the supplies needed for C-sections and safe natural deliveries. And then Rotary in Uganda is this incredible force, more than 150 clubs in a country about the size of the state of Oregon. And so Rotary of Uganda is going to take the lead on community awareness, so that because many of the people we interact with don't realize there's a difference between a woman giving birth at home and a woman giving birth in a public health facility. Now we're talking pretty rural patients who aren't interacting all that often with their local public health facilities. There's a huge opportunity if the quality of care is upgraded through training and equipment to then inform people and help them have a safer delivery by just going into a local public health facility. We're going to be looking at the data on a regular basis and using that to manage this program. And because we've done this training for about 185 maternity workers in the last year, the essential newborn care training, we have already seen leadership networks form, typically by county, and the health workers talk with each other. They talk with the national leaders who have come in to train them. And so we just want to ensure that we're continuing to foster those leadership networks, because there's a lot of opportunity for very low cost further improvement. The Rotary District of Uganda, District 9213, and the past district governor, John Magezi and Demira, who may be on the call, are the leaders for this effort. I'm honored to be a partner with another Rotarian from Wilmette, Illinois, named Steve Jamber, and we've worked together to write this application over about a year now. I lead an organization called Bulamu Healthcare that helps to implement this work. There's another organization, US and Ugandan nonprofit, called Imaging the World, that focuses on ultrasound for improving healthcare outcomes. Here's the great thing about Rotary, or one of them. When we submitted our application, there were 167 support letters that went in with it. It blew us away. I mean, we hoped maybe at first that we'd get to 50, and about 125 of those letters are from Rotary clubs, and then there's some from additional technical partners, UNICEF, the local really world-class university in Uganda, the School of Public Health. It was really quite incredible. And of course, there was a letter from your club that I'm here to say thank you for. along with, all of the things that have made this possible so far. So let me just give you an overview of what has this turned into. Just for last year, we trained about 129 midwives in essential newborn care. They work at 55 public maternity health facilities. After the training, they delivered a bit more than 20,000 babies. They resuscitated 475 of those babies last year successfully. More than 90% of the people we trained said they'd never had the training before. So the difference between having a midwife who knows how to resuscitate a baby and having a midwife who is guessing was about $500 for us to train that person for a week. Along the way, our wonderful partners who lead on the training, they found some empty rooms at community hospitals and they turned them into newborn care units. So we set up 7 newborn care units. And we saw a comprehensive measure of newborn mortality go down by 20% at the first 30 health facilities where we did this. It's going to be a while for us to measure this accurately because people who send the data, who write it down from health facilities, sometimes pay more attention, sometimes pay less attention to what they're sending in. But we can see from multiple metrics here, and the fact that it's a training recommended globally by the World Health Organization, that we're moving in the right direction. So in the interest of time, I'm going to just give you a little overview. Rotary Program of Scale is a $2 million impact prize given once a year for several years. We've asked to be considered for it over 4 years. And we managed to raise some additional funds because of really the network that Rotary of Uganda can organize within the country. So we are at actually about a $5.3 million program over 4 years and growing. And it's our goal, if we were to be selected, our goal is to pass $6 million, pass $8 million, and it would be from significant new foundation partners or institutional donors like USAID. We'd essentially focus on bringing in partners that look for this work and have dedicated funds for it. But again, we never thought we'd have more than a $5 million program. And so we find ourselves in this position thanks to the Rotary network and the respect Rotary has as an organizer. So I'll close with just a few little sites of what does a training look like. This is midwives learning the helping babies breathe technique. This is also midwives learning a technique, skin to skin, which is so effective for so many different newborn and maternal needs that it's recommended as a prescription therapy, but often isn't being used until a midwife has some training that assures her, this is medically about the best thing you can do for a lot of different kinds of babies and mothers. Here's an empty room on the upper left, and there it is turned into a newborn care unit on the lower right. And our partner, one of the leading neonatologists in Uganda, is the woman in the photo, so they were still setting it up there. But I always want to recognize Margaret Nakakito when I have the chance. Here's a mother and a baby, a small baby, receiving care at that newborn care unit. What's really important about these newborn care units at community hospitals is they're close to where the mother is from. These are, for the most part, farming families that live, and don't have easy means of transportation to get out of the country. And so when this is what is available to that family, instead of an empty room, the babies get a significantly better chance at life. And here's that baby at age about 5 months. A nice, serious baby, and in perfect health. And that's, what we just have this incredible good fortune to get to do. There's a couple of key ingredients for success in this kind of work. You need a really good team, and I'm really proud to be here representing I think, the best team I've ever worked on. And you need a clear last mile objective. Ours is more births supported, more births happening at health facilities, and lower maternal and newborn mortality rates. In our case, I think it's very important to say we don't have to invent any of this. This is low cost, fully proven, for the most part, training that needs to be delivered at scale. I find it puzzling that more groups don't do this same work. It's so well proven. If you put in the training, the mortality rates go down. But I'm happy that we can be a leader, and Rotary can be a leader on this issue. So our goal, if we're selected as the program of scale for this year, is to implement this over 4 years, starting on August 1, and to support 1 million mothers and healthy newborns or more. And to show that the kind of network Rotary brings is not limited to any one dimension of what each of us gets out of it, but it is it's one of the most powerful forces in the world. Thank you very much for your time. Tricia, do we have time for a couple of questions? If, please. Please.
Richard, back on your metrics. Excuse me. Richard, back on your metrics. You don't have to go back to that slide. You were saying that you will have better measurements as time goes on, but the decrease went from like 12.6 to 10 point something. Do you know if that was because more people were coming to clinics, or do you have any idea, how you got those numbers?
Great question. So that's a measurement of a rate, a mortality rate per 1,000 births. So what that just measures is is a smaller percentage of people dying, and the answer there is yes. But we have a separate piece of data that we're still learning a bit about, which is what is the number of women who are going in for prenatal care. And from the first 3 months of last year, before we're doing anything in these particular facilities, to the last 3 months of last year, when we had done this training and some equipping in all of them, prenatal care visits, just the pure number, went up by 30%. And of course, that's a leading indicator for our women more likely to have a safer birth outcome, and for them and for their babies. So both as a percentage and as an absolute number, we're seeing it go in the right direction.
Richard, how did you end up in Uganda?
It's a great question. I, in the 2010s, lived in Rwanda for 7 years, and I set up a scholarship program there that still operates, led by some of my old students, and it just passed 400 African students who have accepted about $100 million in scholarships to US universities. And I transitioned that job over to my old students about 5-6 years ago. So it let me move back to Chicago. I got married. I joined Rotary, as I was not traveling as much at the time. And I missed the kind of work I'd been doing. But of course, I didn't have my old job to go back to anymore. And, I'd finished that chapter. So I was just in a kind of a looking mode, and a Chicago philanthropist connected me with the board chair of Bulamu Healthcare and said, the board chair brings a background of working as a for-profit CEO. You bring a background of working in multiple African countries. You might complement each other, and that's been the case. We're both Rotarians, and he's in Uganda right now, though mostly based in the San Diego area.
So when do you plan to start training people the prenatal care?
So prenatal care would be through a training called Helping Mothers Survive. And we have actually started about a month ago. And we've provided around 30 maternity workers with that training. essential newborn, we focused on essential newborn care starting a year ago because the mortality rate for newborns is 2%. And it just requires immediate action. Because the lifetime risk of death in pregnancy in Uganda is also about 2%, we wanted to bring that online. So that's going to be more of a growth area for us this year. If the program of scale selects our application, we would scale that up quite significantly. Thank you all so much. Thank you, Ali.
Okay, thank you so much, Richard. Nope, come back, Richard. And we have a wonderful gift. Okay, we have a gift, a Rotary Club of Chicago plug, and then here's a little, you'll be getting some cookies in the mail from Al's Cookie Mix.
Thank you.
Al's Cookies started a cookie company to provide opportunity to his son and his friends who are diagnosed with autism so that they have a job once they age out of the CPS system. And I'm glad to say that they were featured last night on ABC7 and on WBEZ, and both of those links are in the gyrator. So thank you. All right. So we have some visiting Rotarians in the room. If you'd like to stand up and introduce yourself.
Hi, everyone. My name's Carrie Aiken. I am the DGN for District 6580, which is south of Indianapolis in Indiana, and I'm immediate past president of the Evansville Club that meets at noon. We're the largest club in our district of 250 members, so it's really great to be here. This has been on my bucket list, so I was really excited to be here and also to meet Danilo. I met several of his Serbian counterparts this past summer.
Awesome. And then we have a guest that Chris can introduce.
I just wanted to introduce a friend and colleague, Ayo Ayodele. His father is actually a Rotarian for many years and has gone on some of the global trips. And this is your first meeting of Rotary, actual luncheon. Yeah.
Okay.
So, great.
Right. Well, welcome so much. All right. Okay, and so Rotary Meets Business meets on the first Monday of the month, which is next Monday. Our location is changing, so look out for that email on where our new location is going to be. We hope everyone comes out. Rotary Means Business is not just for Rotarians. It is open to anyone in business who wants to network, as we say, in a different and more meaningful way. And our Job One internship program is open. Applications were due March 9th, but there's a quirk in our application system, so now it's been pushed back for another week to March 15th. So if you know any teachers, counselors, church programs that have youth organizations, please let them know that this summer internship program is available and open for their students to be a part of. And the seniors in that program get to apply for a scholarship or college award up to $2,500 when they complete the program. Oh yeah, sorry. Women of the Year Award. Lisa, would you like to come up and speak on that?
Well, there it is. Everyone, really just very briefly, everybody will receive our nomination form. I think it's going out on Thursday. So this is a call out. It will also go out to our district for nominations. We are targeting May 14th. That is not a set date yet, but it will be very shortly. Thanks for all who are already doing some work behind the scenes to get this going, and this will be number 11. Thanks.
And our CPS Opportunity Grant applications are open. Sarah, did you want to come speak? Okay. So please let all your teachers that work at CPS or something or organizations that, CPS teachers and people who work at CPS schools that work directly with students, correct? Can apply for a grant up to $3,000 for their students, and that is open until April 9th. And every Wednesday, we have our volunteer opportunity at Cornerstone from 2 to 5. You get to help me prep our 185 meals that we make every week. And from 5 to 7:30, we actually serve the guests that come in. And the dictionary project is now available. We go out to Chicago Public Schools and we give dictionaries to third graders. And it's a great opportunity. You just don't realize how excited kids are to get a book. You know, we think they don't use books anymore, but third graders are so amazingly excited to get their first book that's theirs and they don't have to share with their brothers and sisters. They always ask us that, do I get to keep this? And I'm like, it's yours. So come be a part of that. Just reach out to Wes so he can tell you what schools and where to pick up your dictionaries. And your donations to the Rotary One Foundation and to the Rotary Foundation make grant projects like Richard Siegler's happen. That is how we fund and give to those organizations that do such great work in the community and around the world. Our CPS opportunity grants, our Job One internship program, and the scholarships that we give all come from the donations that we give to the Rotary Foundation and to the Rotary One Foundation. So please contact the office or go online to the Rotary Foundation to make sure that you give those donations. And this is the QR code for our our Gyrator newsletter. If you haven't received it, you can check that QR code, and I believe they're on the table also. Or you can go to the office and they can put you on the mailing list. Our upcoming committee meetings, our DEI, community service, Job One meetings meet every 2 weeks because we have just a lot of work to do in a short amount of time. Membership, please reach out to any of these committee chairs to be a part of the committees. They're always looking for more interaction and more members. These are our upcoming meetings. We are not having a meeting next week. We're going to give everybody a break. And so we will have the roundtable this Friday and next Friday. Rotary Means Business on March 4th, and then our next in-person meeting will be on March 12th. And with that, if everyone could stand so we can do the four-way test. The four-way test of the things we think, say, or do. Number 1. Is it the truth? Number 2. Is it fair to all concerned? Number 3. Will it build goodwill and better friendships? Number 4. Will it be beneficial to all concerned? And number 5. Will it be fun? All right, and with that, I adjourn the meeting.